Welcome back. The GPs you're about to meet want the best for their patients, but if they're guilty of one thing, it's that they care too much. Bulk billing is sending them broke.
These days, a trip to the doctor isn't cheap.
$70, $100.
I had a friend who got nipped by a dog and cost them $392. No stitches, nothing.
You don't want too many of those a week, do you?
No, definitely not with me kids.
Yeah.
Now, the one saving grace, especially for our most vulnerable, appears on the way out.
I believe in bulk billing. At the moment, we can't afford to do it.
Bulk billing, where you can walk in and out of the doctors without paying a cent. Not all GPs do it, and sadly now some that do say it's sending them broke.
So how are you going with everything?
Lots of patients are not happy.
Dr Mari Healy works at Redfern Station Medical Centre in Sydney. Most of its patients are battlers, and this week, sadly, the surgery scrapped bulk billing.
This is the first time that I've ever had to justify to a person on a pension why we'd like them to pay a gap fee. And I feel greedy and mean, but I've already been at a practice that's closed because of the poor funding of general practice. Come on down, Don.
Dr Healy says when a patient is bulk billed, it doesn't cover the cost of running a doctor's surgery.
About a third goes to the practice, a third goes in tax, and I've got $15 in my pocket. And out of that $15 that goes towards the practice, they're paying registered nurses, highly trained reception staff, they're buying equipment.
You're running a business.
That's it.
After 2 years of going backwards, I realised that I just could not do it anymore.
Dr Adrian Jones had to close his practice for, well, caring too much.
I think a lot of people would be shocked hearing that you had to close your business.
Yep.
It's a doctor surgery, it's always busy.
Yeah, I was shocked too. I mean, look, I spent 2 or 3 years coming to terms with it. Medicare rebate is just so poor.
Right now, GPs get a $39.10 Medicare rebate from the government if they bulk bill. But if you're a plumber and call on a job for a 15-minute consult, that's $85 in the hands.
The pipes that the doctors are working on are a little bit more important than the pipes that the plumbers are working on.
They've still got bills to pay and most of their premises are rented. Rents are going up as well. They're kind of stuffed, aren't they?
The problem is the Medicare rebates have not been indexed at the same rate that inflation has been going up. That number should probably be at least double what it is now.
Dr Lim, who bulk bills half of his patients in Sydney's Mount Druitt, says the government needs to put health first.
If you don't invest in health at the beginning, then you're not going to get good health outcomes down the track.
Is this the death of bulk billing?
That's how it stands at the moment.